All right, so you sent over this case study about a patient who had a right-sided pneumonectomy.
Yes.
Now, for anyone who may not be familiar with that term, a pneumonectomy is the
Uh,
surgical removal of an entire lung.
yeah,
And it's intense stuff.
it is.
But I think what's fascinating about this case study is that even though the patient is missing an entire lung, there are still breath sounds
Right.
on that
It,
side.
it's counterintuitive,
It is.
but it just goes to show you how amazing the body is
It really does.
in terms of adapting and how we can use the findings on the physical exam to tell us a lot about what's going on.
Okay, so let's walk through some of those physical exam findings.
Sure.
What's the first thing that jumps out at you?
Well, first of all, you see a big thoracotomy scar, and that tells you that this patient had an open chest surgery as opposed to a minimally invasive technique.
So no tiny incisions here?
No tiny incisions, and then the evidence of the missing lung itself.
Oh.
So there will be reduced chest expansion on that side, and there'll be dullness to percussion, meaning when you tap on the chest,
Oh.
you're going to hear a thud because there's no air-filled lung underneath.
So it's not going to sound like a resonant drum or anything like that.
No, but this is where it gets interesting. So the physical exam findings
Okay.
note bronchial breath, sounds in the upper right chest.
Wait, so where are those sounds coming from if the lung is gone?
So that's kind of like an acoustic trick,
Mhm.
because what happens is the airways shift, and you're actually hearing the sounds transmitted
Uh-huh.
from those displaced airways.
Wow.
So it makes you think that there are breath sounds when really there shouldn't be.
That's incredible. The notes also mention a mediastinal shift.
Yes.
What exactly is that?
So the mediastinum is this central compartment in your chest.
Okay.
And it contains the heart, the great vessels, and the trachea, esophagus, a lot of important structures.
Mm.
And normally, it's pretty symmetrical. But when you take out a whole lung, it creates this vacuum effect.
Oh.
And everything gets pulled toward that empty space.
So everything in the chest kind of gets rearranged.
Exactly. And that's evident in the position of the trachea, which is the windpipe,
Okay.
and also the apex beat, which
Mm.
is the point where you feel the heartbeat most strongly, will be shifted as well.
Wow. Okay. That makes sense.
Yeah.
But then it mentions bowel sounds in the right chest.
Yes.
Now that seems even more strange than the phantom breath sounds we were just talking about.
Right. So that's all part of that empty space thing again.
Okay.
When everything shifts towards that vacuum,
Okay.
sometimes parts of the bowel can actually move up into the chest cavity.
So you're telling me a doctor could be listening to someone's chest and hear their stomach gurgling?
Well, it's not a common finding, but it does happen.
Wow.
And it just goes to show you how everything is connected.
Oh, that's also fascinating. We've talked about what the doctor heard, but let's talk about why someone would even need this procedure in the first place.
Right. So unfortunately, the most common reason is lung cancer. And it really depends on the type and location of the tumor as to whether a lobectomy,
Hmm.
which is a removal of just a lobe of the lung, or a pneumonectomy would be necessary.
So it sounds like the location of that tumor makes a big difference in terms of what kind of surgical approach you're going to take.
It does. If it's a central tumor, meaning that it's involving those main branches of the airways,
Yeah.
then often you need a pneumonectomy because you can't really just take out part of it.
Okay.
Got to kind of take out the whole thing.
That makes sense.
Uh,
Now, the notes did mention some less common reasons why someone might need a lobectomy or pneumonectomy.
mhm.
What are some of those?
So besides lung cancer, you might see it done for malignant nodules,
Okay.
a condition called bronchiectasis, where the airways become permanently widened and damaged,
Okay.
severe lung trauma, anything causing significant damage that can't be addressed with less invasive options.
Okay. So let's say someone is facing this type of surgery.
Mhm.
What happens before they even go under the knife?
Well, there's a lot of pre-surgical assessment that needs to be done.
Oh. Mm-hmm.
And the medical team has to determine if the patient's even strong enough to handle losing a whole lung or even part of a lung.
Right. Because even if you're just doing a lobectomy, you're still reducing their lung capacity.
Exactly. They do rigorous lung function testing to see how much air they can breathe in and out and how well the remaining lung will be able to function.
Okay.
They also look at their overall performance status,
Mm-hmm.
kind of like their fitness level, and determine if they can withstand the surgery itself and if they can bounce back afterward.
Because we are talking about a major operation and recovery.
It is.
So what about after the surgery? What are the key things to watch for during recovery?
Well, postoperative care is all about vigilance,
Mm-hmm.
especially for lung cancer patients. We're really looking for any signs that cancer might be recurring.
Okay, so what kind of signs would raise a red flag?
So we're looking for things like unexplained weight loss, a general wasting away,
Okay.
that we call cachexia,
Mm-hmm.
a new or worsening cough, shortness of breath, and especially coughing up blood.
I would imagine coughing up blood would be very concerning.
Yeah, it's a sign that we can't ignore
Okay.
because it could mean that the cancer has spread to the airways or the
Mm,
blood vessels.
I see.
We also closely monitor their lung function using various tests like spirometry,
Okay.
which measures how much air they can breathe in and out, and any significant decline from their baseline, meaning how they were doing before the surgery, could be a cause for concern.
So it's all about tracking their progress and looking for any sudden dips.
Exactly.
And I'm guessing throughout all of this, you're emphasizing the importance of smoking cessation.
Absolutely for these patients.
Crucial, especially since many patients who undergo these procedures are smokers.
Because continuing to smoke would just increase the risk of that cancer coming back.
Yeah, it's not just the risk of the cancer coming back, it's
Right.
a risk of a whole host of other things too. Heart disease, stroke, other types of cancer.
Right, right. It's almost like pouring gasoline on a fire.
Exactly.
So we've talked about the reasons why someone might need this surgery.
Right.
And what happens before and after.
Yeah.
Let's shift gears now and talk about the HOW.
Okay.
So the notes mentioned this patient had a traditional thoracotomy,
Right.
but you also mentioned VATS, video-assisted thoracoscopic surgery, is
Yeah.
kind of a less invasive alternative.
Right.
Can you talk a little bit more about that?
Yeah, VATS has been a real game changer for a lot of thoracic procedures.
Hmm.
Basically, you're comparing open chest surgery to something that's done through just a few little keyhole incisions.
Oh, wow.
It's like night and day.
So less pain, faster recovery. I can see why that's appealing.
Absolutely. There's less pain, shorter hospital stays,
Mm-hmm.
quicker return to normal activities, less blood loss, and lower risk of complications.
Wow.
And because the surgeon is working with this magnified view on a video monitor, they can have incredible precision.
It sounds like a win-win all around.
Yeah.
So is VATS becoming like the gold standard for these types of procedures?
It's definitely getting a lot of traction, especially for lobectomies.
However, for now, a complete pneumonectomy still requires the open approach of a thoracotomy.
Okay.
The complexity of taking out the entire lung still requires that more traditional method.
So VATS for lobectomies, open surgery for pneumonectomies.
Exactly.
Got it. It makes you wonder, though, what does the future hold? Do you think we'll eventually see VATS being used for pneumonectomies as well?
It's possible surgical techniques are constantly evolving,
Mm.
and there's a huge push towards minimally invasive approaches.
Right.
So who knows what's on the horizon?
That's exciting to think about. Imagine a future where even the most complex lung surgery can be done with just a few tiny incisions.
Absolutely.
But for now, let's bring it back to the present
Okay.
and this particular patient case.
Right.
One thing that stood out to me in the notes was the emphasis on monitoring for signs of disease recurrence
Yes.
during those post-operative checkups.
Yes, absolutely.
Especially because lung cancer is the most common reason why someone might have one of these procedures done. It seems like you'd really want to be on top of that.
You do. You want to be very vigilant.
Okay, so walk us through it. What are doctors looking for during those checkups?
So it's a multi-pronged approach.
Okay.
We're looking for any general signs of decline.
Hmm.
Has the patient lost a significant amount of weight?
Okay.
Do they seem weaker or more fatigued than usual?
Mm-hmm. So those could be signs that maybe that cancer is spreading.
Exactly,
Yeah.
exactly.
Okay.
And then we really zero in on those respiratory symptoms.
Mm-hmm.
Is there a new or worsening cough?
Okay.
Any shortness of breath that's out of the ordinary?
Mm-hmm.
And, of course, we have to ask about the dreaded hemoptysis, which is coughing up blood.
That sounds scary.
It is. Hemoptysis is a major red flag.
Okay.
It could mean that the cancer has invaded the airways or the blood vessels.
I see. And how do you go about assessing changes in their lung function?
So we use several different tests, but spirometry is one of the key ones.
Okay.
It measures how much air they can inhale and exhale, how quickly they can do it,
Hmm.
and any significant decline from their baseline, which is how they were doing before the surgery,
Hmm.
could be a sign that something's wrong.
So it's about comparing where they are now to where they were pre-surgery and looking for any concerning trends.
Precisely.
And I imagine throughout all of this, you're still really emphasizing smoking cessation.
Absolutely. It's non-negotiable.
Oh,
If
yeah.
the patient is still smoking, we're going to do everything we can to help them quit.
Because it really exacerbates all those risks we've been talking about.
It does. It's like adding fuel to the fire.
Yeah.
Kicking the habit is a cornerstone of their recovery and long-term health maintenance.
All right, so let's recap. After the surgery, it's all about close monitoring for any signs of cancer recurrence,
Yes.
addressing smoking habits, and basically just being really proactive about the patient's overall health.
That's a great summary.
Okay.
It really requires a team effort involving the surgeon, the oncologist, respiratory therapists,
Hmm.
and, of course, the patient themselves.
Speaking of the surgical team, we were talking about this patient having a traditional thoracotomy, and
Yes.
you mentioned VATS, video-assisted thoracoscopic surgery,
Hmm.
as a less invasive option.
Hmm?
Can you elaborate a little bit more on the advantages of VATS?
Sure, VTS has really revolutionized a lot of thoracic procedures.
Mm-hmm.
It's like night and day compared to open chest surgery.
So paint us a picture. What are some of the main benefits?
So the most obvious benefit is the smaller incisions.
Yeah.
Instead of this big muscle-cutting incision of a thoracotomy,
Mm-hmm.
we're talking about just a few little keyhole incisions.
So less pain, faster recovery.
Exactly. Patients typically experience less pain,
Okay.
they require less pain medication, and they can go home sooner.
Mm-hmm.
There's also less blood loss and a lower risk of complications.
Wow, it really does sound like a win-win.
It often is.
Yeah.
And because the surgeon is working with this magnified view on a video monitor, they can operate with incredible precision.
That makes sense. But you did mention that VATS isn't suitable for all procedures.
That's correct.
And specifically, a full pneumonectomy still requires open surgery.
It does. While VATS has really expanded the scope of minimally invasive thoracic surgery,
Mm-hmm.
a complete pneumonectomy is still a more complex procedure,
Okay.
and it requires that traditional approach.
So open surgery for pneumonectomy,
Yes,
VATS for lobectomy.
correct.
Got it. It makes you wonder what the future holds. Do you think we'll eventually see VATS being used for pneumonectomies as well?
It's possible surgical techniques are always evolving,
Right.
and that push towards minimally invasive approaches is relentless.
Yeah.
So who knows what breakthroughs are on the horizon?
It is exciting to think about. Imagine a future where even the most complex lung surgeries can be done with just a few tiny incisions.
I agree.
The recovery time and the overall impact on the patient would just be incredible.
Absolutely. It's amazing. It's a testament to human ingenuity
It is.
and the constant pursuit of better patient care.
Well, before we get too carried away with futuristic visions, let's
Right.
bring it back to our patient. We've covered their physical exam findings,
Mm-hmm.
the reasons why they might have had the surgery,
Yeah.
post-operative care,
Mm-hmm.
even touched on surgical techniques.
Right?
Is there anything else we should consider?
Yes, there's one very important aspect that we haven't talked about yet,
Okay.
and that's the psychological impact of a procedure like this.
Oh, of course. I mean, losing an entire lung or even just a lobe
Yeah.
can't be easy to cope with.
It's a huge adjustment, both physically and emotionally.
Mm-hmm.
Imagine the fear, the uncertainty,
Yeah.
the potential limitations on your activities.
Yeah. And probably a whole lot of grief, too, for the loss of a part of their body.
Absolutely. It's a profound experience.
Yeah.
And we really need to acknowledge and address that emotional and psychological well-being.
So what kind of support is available to these patients?
Well, ideally, it would be a multidisciplinary approach.
Okay.
Support groups can be incredibly helpful,
Okay.
connecting patients with others who understand what they're going through.
Right?
Counseling can provide support in coping strategies.
Mm-hmm.
And sometimes just having a compassionate medical team who listens and validates their concerns can make all the difference in the world.
That makes sense. It's about treating the whole person, not just the physical condition.
Exactly. We can't forget that behind every medical chart, every surgical scar is a human being
Right.
with thoughts and feelings and a unique story to tell.
You know, this deep dive has been incredibly insightful.
Good.
Thank you again for sharing your expertise.
My pleasure.
And to our listener, thank you for joining us on this journey into the world of thoracic surgery.
Yes.
We hope you're finding it as fascinating as we are, but we're not done yet.
Right.
Join us for part 2,
Yes.
where we'll discuss the advancements in non-surgical treatments for lung conditions,
Yes.
and we'll explore what the future might hold for respiratory health.
Looking forward to it.
We'll see you there.
See you there. You know, it really makes you appreciate the resilience of the human body.
Yeah, absolutely. I mean, to go through something as major as a pneumonectomy and still be able to adapt and function,
Right.
it's incredible. But, you know, as you were saying, it's not just about the physical recovery.
Right.
Addressing the emotional and psychological impact is really important too.
Absolutely. I mean, I've seen it firsthand. You know, patients really struggle with the emotional weight of losing a part of their body.
Yeah.
The fear, the uncertainty, the limitations, it can all feel pretty overwhelming.
I bet. So how can the medical team help patients to kind of navigate all of those difficult emotions?
Well, ideally, it's a multidisciplinary approach.
Okay.
Support groups can be great, connecting patients with others
Mm,
who understand what they're going through.
right. That makes sense.
Counseling can also be helpful
Yeah.
just to provide, support and coping strategies.
Right. It's about having a safe space to process all of those feelings and
Exactly.
adjust to this new reality. Right. And sometimes, honestly, just having a compassionate medical team
Yeah.
who listens to the patient and validates their concerns
Mm.
can make a world of difference.
Right. It's that human connection.
It
It's
is.
about treating the whole person, not just the physical condition.
Exactly. We can't forget that behind every medical chart,
Yeah.
behind every surgical scar,
Mm.
is a human being with thoughts and feelings and a unique story.
It's well said. It's amazing how far surgical techniques have come,
Right.
especially with all the advancements in VATS.
Yes.
Um, but I'm curious, what about those situations where surgery isn't an option?
Hmm.
Or maybe it's just not the best course of treatment?
Well, that's a great question, and thankfully, we've seen huge progress in non-surgical approaches as well.
Right.
For example, in lung cancer treatment, we have targeted therapies and immunotherapies.
Yeah, I've heard a lot about those. Can you kind of break them down for us a little bit?
Sure, so targeted therapies are designed to go after very specific molecules.
That are involved in cancer growth?
Mm-hmm.
They're kind of like guided missiles,
Okay.
homing in on the cancer cells while sparing the healthy ones.
So more precise and less damage to surrounding tissue.
Exactly.
Okay.
Immunotherapy, on the other hand, harnesses the power of the patient's own immune system
Okay.
to fight the cancer.
Mm-hmm. So instead of attacking the cancer directly,
Mm-hmm.
you're basically boosting the body's natural defenses to do the work.
Exactly. It's pretty revolutionary, and it's really been making waves in cancer treatment.
It sounds incredibly promising.
All right.
So are these therapies completely replacing surgery?
Well, not necessarily. It really depends on the specific type of cancer
Okay.
and the stage of the cancer. Sometimes surgery is still the best initial approach,
Hmm.
but these therapies can be used before or after surgery to improve outcomes.
Okay, so it's about finding the right combination of treatments for each individual patient.
Exactly. It's not one size fits all.
That makes sense. Now, what about for those conditions that aren't cancer? Are there any exciting non-surgical developments happening in those areas?
Absolutely. For example, in interventional pulmonology,
Okay.
we're using minimally invasive techniques to diagnose and treat a wide range of lung conditions.
Interventional pulmonology, that sounds pretty high tech.
It is. We use specialized scopes and catheters
Okay.
to access the airways and lungs,
Hmm.
and we're often guided by imaging techniques.
So instead of open surgery, you're basically working from the inside out.
Exactly. And it's amazing what we can achieve with these minimally invasive tools.
Mm-hmm.
We can remove blockages in the airways.
All right.
We can biopsy suspicious lesions. We can even place stents to keep the airways open.
Wow, the possibilities seem kind of endless. It sounds like this field is constantly evolving.
It is. It's a really exciting time to be involved in pulmonary medicine.
You know, what strikes me is that all these advancements in
Hmm.
both surgical and non-surgical techniques are really converging
Right.
to offer patients more options and better outcomes.
Absolutely. We're moving towards a much more personalized approach to respiratory health,
Okay.
where the treatments are really tailored to the individual's needs and their specific condition.
Yeah, that makes sense. And with technology constantly advancing,
Right.
it makes you wonder what the future holds for respiratory care.
It does.
I mean, we've come so far from those days of,
Yeah,
the traditional thoracotomies and the limited treatment options.
absolutely. And I think we're just at the beginning. I
Yeah,
think we're on the cusp of some truly groundbreaking advancements.
I can't wait to see what the future brings.
Me too.
But for now, let's shift our focus back to our patient case study
Okay.
and those fascinating physical exam findings that we discussed.
Right.
What are some of the key takeaways from those observations?
Well, those findings really just highlight how adaptable the body is,
Hmm?
even after a major surgery like this.
Yeah.
The fact that you might hear breath sounds where the lung used to be. The shift in the mediastinum,
Hmm.
even the possibility of bowel sounds in the chest,
Right.
it all speaks to the body's incredible ability to compensate.
It's almost like the body is trying to fill that void
It is.
left by the missing lung.
Yeah, it's a reminder of how interconnected
Yep.
all of our internal systems are
Hmm.
and how they can work together to maintain some kind of balance, even after a major change.
That's really incredible. But those findings also highlight the importance of being very observant
Oh, absolutely.
and really understanding the nuances of those post-operative changes.
Yes, recognizing those subtle signs
Yeah.
allows us to monitor the recovery,
Hmm.
anticipate any complications,
Right.
and intervene early if we need to.
It's a reminder that even after the surgery is over, the journey isn't finished.
Right.
There's still that ongoing monitoring and management and support that's required
Absolutely.
to ensure the patient's well-being.
It's a continuous process of
Yeah.
assessment, adaptation, collaboration
Yeah.
between the medical team and the patient.
You know, this deep dive has really given me a lot to think about.
Good.
It's inspiring to see how far we've come in treating these lung conditions.
Hmm.
And it's really exciting to think about what the future holds.
Yeah.
But before we wrap up part 2,
Okay.
I want to shift gears for a moment and
Sure.
talk about something that's often overlooked
Okay.
in these types of medical discussions,
Ah.
and that's the patient's perspective.
Right. It's easy to get caught up in all the technical stuff
Yeah,
and forget about the human experience.
exactly. So tell me, what are some of the challenges and triumphs
Sure.
that you've witnessed in patients who've gone through these life-altering procedures?
Well, it's a real roller coaster of emotions.
Okay.
I mean, there's a lot of fear and anxiety in the lead up to the surgery.
Mm-hmm.
You know, the thought of losing a lung or even just part of a lung
Right.
is understandably scary.
Yeah.
And then the recovery process can
Mhm.
be long and difficult.
Yeah. Yeah. It must take immense courage and resilience
It
to
does.
go through something like that.
It really does.
Yeah.
But what's truly inspiring
Mm-hmm.
is to see the strength and determination of these patients.
Yeah.
They find ways to adapt, to cope,
Mhm.
and to rebuild their lives.
I'm curious, what are some of the things that help them to navigate
Yeah.
such a challenging journey?
Well, support systems are key.
Okay.
Having loved ones who offer encouragement and practical help
Mm-hmm.
can make a huge difference.
Right.
And as we talked about earlier,
Yeah.
support groups and counseling can give them that safe space
Right.
to process their feelings and connect with others.
Right. It's that sense of community,
It is.
knowing that they're not alone.
Exactly. And sometimes,
Yeah.
it's those small victories that have the biggest impact.
Okay.
Being able to breathe a little easier,
Mhm.
walk a little further,
Yeah.
return to some of the activities they used to enjoy.
Yeah.
Those milestones can be really empowering.
Right. It's about regaining that sense of normalcy and control.
Exactly.
After feeling like their body has kind of betrayed them in a way.
Yeah, it's about reclaiming their health and their lives.
That's a great way to put it. And,
Yeah.
it's important to recognize that the journey isn't over
Right.
when that surgical wound heals.
No, absolutely not.
It's an ongoing process
It is.
of adaptation physically and emotionally.
Exactly.
And the medical team really plays such a vital role
Yes.
in providing that ongoing support
Mhm.
and monitoring and guidance as the patient navigates all of the long-term implications
Right.
of living with reduced lung capacity.
It is a reminder that healthcare isn't just about treating the physical condition.
Yeah,
It's about supporting the whole person
right.
throughout their journey.
Well said. And that's something that we should all keep in mind,
Yeah.
whether we're medical professionals or
Mhm.
just individuals supporting loved ones who are going through their own health challenges. This conversation has given me so much to think about.
Good. I'm glad.
It's inspiring to see how far we've come,
Yeah.
and it's really exciting to imagine what the future holds.
It is.
But before we get too carried away with those futuristic visions,
Right.
let's bring it back to the present
Okay.
and those critical post-operative checkups
Yes.
that we were talking about.
Yes, they're so important
Yeah.
for monitoring recovery and making sure that everything's going well.
Exactly. But we'll dive into all of those details in part 3 of this deep dive.
You will.
So join us as we continue to explore the world of respiratory health,
Yes.
from post-operative care to the potential for groundbreaking advancements in the
Good.
field.
I'm looking forward to it.
We'll see you there.
See you there.
Welcome back to our deep dive, everybody. It's been a really fascinating look into the world of respiratory surgery.
It has.
We've talked about a lot, those amazing physical exam findings,
Yeah.
the advancements in surgical and non-surgical treatments,
Uh-huh.
and of course, those inspiring stories of patient resilience.
That's
But as we were saying at the end of part 2, those post-operative checkups are so important.
yes.
So let's pick up where we left off and talk about what those checkups actually look like in detail.
Okay, so let's imagine our patient is recovering well from surgery. They've gone through that initial healing phase, and now they're coming in for these regular follow-up appointments.
Okay.
These checkups are all about vigilance. It's about making sure we stay one step ahead of any potential complications or, signs of recurrence, especially if the surgery was done for lung cancer.
So it's like a safety net, catching any problems early on.
Exactly. Exactly.
Yeah.
During these checkups, the doctor is going to do a thorough physical exam.
Okay.
They'll listen to the patient's lungs, check their breathing, feel for any unusual lumps or bumps,
Mm-hmm.
and of course, they'll ask about any new or worsening symptoms,
Yeah.
like coughing, shortness of breath, fatigue, things like that.
And I imagine if the patient was a smoker, these checkups would be a good opportunity to reinforce the importance of quitting.
Oh, absolutely. Smoking cessation is so important
Yeah.
for long-term health and to reduce the risk of any future problems.
Right.
The doctor might offer some counseling, maybe prescribe medications, or refer the patient to a smoking cessation program.
So it's really that ongoing support and guidance.
It is. It is. Now, depending on the patient's individual case and the reason for their surgery, the doctor might also order some tests.
Okay.
So, for example, they might do a chest x-ray or a CT scan to look for any changes in the lungs.
Mm-hmm.
They might also order some blood tests
Okay.
to check on the patient's overall health and look for any signs of recurrence.
So it's this combination of careful observation,
Yes.
symptom assessment, and then
Yes.
those targeted tests.
Exactly. And remember we talked about spirometry,
Yes.
that test that measures lung function?
Mm-hmm.
That's also usually a key part of these postoperative checkups.
Right. To see how well that remaining lung is working.
Exactly. And to make sure there hasn't been any decline.
Right.
By comparing the results to the patient's baseline,
Mm-hmm.
meaning how they were doing before surgery, the doctor can really track their progress and see if anything's off.
It's really fascinating how all of this comes together. It sounds like a very thorough and proactive approach
It is.
to monitoring the recovery.
It is. And we can't forget that these checkups aren't just about the physical aspects of healing.
Right.
The doctor also needs to know how the patient is coping emotionally and psychologically.
Of course, because losing a lung or even part of a lung
Yeah.
is going to have a huge impact
A huge impact.
on their mental and emotional well-being.
Absolutely.
Huh.
The doctor might ask about their mood, their sleep patterns, energy levels,
Okay.
any concerns they have about their recovery or being able to return to their normal activities.
So it's about acknowledging that recovery isn't just physical,
Right.
it's that emotional and psychological adjustment as well.
You got it. And, if the patient's struggling, the doctor can offer support, counseling, maybe refer them to some specialists.
Okay.
Remember, it's a team effort,
Yeah.
and the patient should never hesitate to reach out for help.
It sounds like that open communication and trust with your doctor is so important.
Oh, it's essential.
Yeah.
Now, I want to shift gears a little bit and talk about the future of respiratory care.
Okay.
We've touched on some of the advancements, but what else might we see down the road?
It's exciting to think about. Just imagine a world where we can treat these lung conditions with even greater precision and with minimal invasion,
Right.
truly personalized care.
I know. Well, one area that I think is incredibly promising is regenerative medicine.
Okay.
Imagine being able to repair damaged lung tissue
Wow.
or even grow new lungs
Okay.
using things like stem cells or other really advanced techniques.
That sounds like science fiction.
It does, but it's getting closer to reality.
Yeah.
Researchers are making incredible strides in understanding how to use stem cells to regenerate those damaged tissues and organs.
And if they could apply that to the lungs,
No.
it would be revolutionary for patients with COPD, pulmonary fibrosis,
Yes.
those needing a lung transplant.
Absolutely. It could potentially offer a cure for diseases that right now have very limited treatment options.
That's incredible. What about advancements in personalized medicine? How might that shape the future?
So personalized medicine is all about tailoring the treatment to the individual patient, their unique genetic makeup, lifestyle, environmental factors. And we're already seeing this happen in cancer treatment with targeted therapies.
Right.
And I think we'll start to see a similar trend in respiratory care.
So instead of that one-size-fits-all approach,
Yeah,
treatments will be more specific to the patient's needs.
exactly. Imagine being able to predict someone's risk of developing a certain lung disease based on their genes or tailor their medications based on their genetic profile.
That would be incredible, especially for prevention and early intervention.
Absolutely. And it could also lead to more effective treatments with fewer side effects.
Now, what about technology? Are there any new technologies that could have a big impact?
Yeah, definitely. Wearable sensors and artificial intelligence are getting more and more advanced all the time.
Okay.
Imagine a world where patients can monitor their lung function at home
Okay.
using a wearable device that sends data directly to their doctor.
Wow.
So the doctor could keep an eye on things remotely and intervene early
Yeah.
if there are any problems.
Yeah, that'd be great.
And with AI, We could analyze huge amounts of data
Mm-hmm.
to identify patterns and predict outcomes with much greater accuracy.
It's like having a virtual assistant for your health.
It is.
Yeah.
It could revolutionize how we approach respiratory care,
Wow.
from prevention and diagnosis to treatment and long-term management.
Well, this deep dive has really opened my eyes to the vast world of respiratory health. It's been an amazing journey.
It has.
From the details of those surgical procedures to the potential for all these incredible advancements.
I agree.
I think what really stands out to me is how much progress we've already made.
Yes.
It feels like we're moving towards a future where lung conditions can be treated with precision and minimal invasion.
Absolutely.
Really personalized care.
Yes, it's an exciting time.
It is. And it's all thanks to the researchers, the doctors, the healthcare professionals who are constantly pushing those boundaries.
And the patients who inspire us
Of course.
with their resilience.
It's been great talking with you today.
Likewise.
To our listener, thank you for joining us on this exploration of the world of respiratory health.
Thank you.
We hope you found it as insightful and inspiring as we did.
We did.
Remember, knowledge is power.
Absolutely.
And by understanding our bodies and the advancements in healthcare, we can really empower ourselves to make the best decisions about our health and well-being. But as with any deep dive, there's always more to explore.
Always.
So stay curious.
Yeah, stay curious.